We are on to one of my favorite topics, which is talking about doulas. And so, as you know, our name is DoulaDoc, and we are going to talk about doulas. And that is because this is a great time to kind of start this planning and preparation. And ideally, if you're considering a doula, you want to find that person early on in your pregnancy journey so that you have some time to get to know each other and form a relationship so that you have this nice team of support heading into labor. So we at DoulaDoc obviously encourage you to consider finding a doula. And there are some programs in some states that actually have insurance coverage to provide for doula services. So this is something you could look into your health insurance and see what is covered. And if not, it is typically an out-of-pocket expense, but there are many places that will offer services at free or reduced rates if it is cost prohibitive to you. So let's talk about what is a doula, what they offer, how to find one, and if it's right for you. So a doula is a non-medical support person who provides continuous care through labor and birth. So unlike doctors and nurses, unfortunately, we work shift work and cannot stay the entire time for your labor sometimes. So nurses often work on 12-hour shifts and doctors often work on 12 or 24-hour shifts. And at the end of our shift, we're going to go home. But at the end of our shift, you might still be right in the middle of labor. And so this person is someone who will stay there with you throughout, from the very early moments of labor until delivery and after postpartum. They come from a lot of different backgrounds. Typically, they're not medical, but they complete a training program and certification program that gives them the information and support so that they can provide these tools to others. Now, this is something to consider and something to ask when you are looking at doulas, is that just like doctors, just like nurses, not all doulas are the same, and you will want to kind of look into asking them what their training is and what their background is, and if they completed a certification program through a nationally or internationally recognized organization or not. And so that's just information that you can get when you are interviewing doulas, and we'll talk about that more. So while certification is not required, it does ensure that the doula has had specific training and met certain requirements, and there are several different organizing bodies that are available. So there are 4 pillars of doula support. The first is physical support. So they can help in labor with different positions, with counter pressure, with massage, and just help creating this calm birth environment, and also help with your partner. So this is not somebody to replace your partner. Even if you have a partner that wants to be involved in hands-on, a doula can still be great because they can help get your partner involved. They can give your partner ideas. This is how you could help them. Why don't you try this? You could, slow dance. You guys could walk. And so it's just another person to help kind of coach you through. And most people's partners have never been through this either. And so they're going to be new and nervous and, going through their own emotions, that it's nice to have another person there that can be steady and grounded and help with this transition. So the next thing they do is emotional support, and that is through building reassurance and encouragement, and sometimes giving you your partner a break if they just need to get a little fresh air. They often, like I said, meet you sometime in pregnancy and build a rapport so that you guys get to know each other and have a connection. And this helps build confidence when you come in labor and birth. So the third pillar is informational support, and this acts as a bridge between your medical provider and you. So your doula is not there to tell you medical advice, and your doula is not there to speak for you. But your doula can help you think of questions to ask your provider, or encourage you to ask for other options, or help explain interventions or next steps that your provider might recommend. And so at the end of the day, you are the one making the decisions and speaking for yourself, but this person can help you get there and help you form those questions and those decisions, and also help you understand better if it's something that seems confusing. And then the fourth thing is advocacy, and this ties into that information support, but they're going to encourage you to speak up for yourself and your wishes, and kind of enhance that barrier that sometimes exists between patient and provider by opening those lines of communication. And so this is just to support your birth vision without replacing your care team or your provider, but just as kind of another person in your network. Now, there is actually good evidence that supports doula care. So there are, in a review of 26 studies involving over 15,000 births, they found that doula-supported births were associated with higher rates of unassisted vaginal delivery, lower rates of cesarean delivery, vacuum and forceps, reduced need for pain medication, shorter labors, and better emotional outcomes. Now, these results all came from doulas who were trained and who were independent from the hospital. So they were not associated with the care team, and they were also not family members of the patient. Now, again, like I mentioned, doulas often work alongside your partner, and they do not replace them. They can help guide your partner and give your partner breaks, and they can help your partner feel confident in kind of how to help you and what to do next. And sometimes providing your partner reassurance, because it's really hard to see your loved one going through something that might be painful. And so they also need support through this process. So where do you start with finding a doula? Typically, you want to search locally. Many doulas have websites or social media pages, and you can often find sometimes a group of doulas or individual doulas that work together. And sometimes there might be local events where you can kind of like meet doulas and speed date so that you can meet a couple different ones. But again, just like when we were talking about finding a provider, this is a personality decision, and you want somebody that you feel comfortable with, as well as somebody that you feel confident in their training and expertise. I encourage you to look for somebody who understands and supports your birth plan. And remember, they're going to be there for some very intimate moments. So you want to feel comfortable with them. Now, like I mentioned before, fees vary based off of the doula's training, certification, and experience. Some new doulas that aren't yet certified will offer their services at a reduced cost, or there are some programs to help cover doula fees if you could not afford it. And typically, doulas, like I said, will work with other doulas so that they have some backup coverage while they do try to be on call 24/7 near your due date. Sometimes things happen and they can't be there. So that's just something else you want to ask about when you're interviewing a doula, is their backup coverage. So how does this look in your pregnancy? Typically, you meet them once or twice during pregnancy. You might communicate via email or text and kind of share what your birth vision is, what your plans are, what you're thinking about in terms of pain management or where you want to labor. And, if you have any past birth experiences that are coming up, that they'll want to talk about those as well, just so they kind of know what to expect. And then during labor, they can either join you in early labor at your home and labor with you there, or they can meet you at the hospital, but they stay throughout all of labor through birth, and then typically for a few hours afterwards, just to help you get breastfeeding established and see if there's anything else you need. And then typically doulas will check in again postpartum at a couple weeks to see how you're doing, and again, help out with breastfeeding if you need it or anything else that you might need. There are some doulas that specialize in postpartum care, and they offer things like breastfeeding support, household help, and overnight newborn care. So that is also something that you can consider, or that you might see when you're researching doulas in your area. Just as one more little mythbuster disclaimer, you can still have a doula if you're planning an epidural. You technically can still have a doula if you're planning a C-section. They might not be allowed to be in the operating room, but they can still be there just to help you facilitate those questions beforehand, to help you with breastfeeding afterwards. And even if you have an epidural, they can help with positioning, they can help with pushing. Again, their expertise is multifaceted and helps out in a variety of areas. So bottom line, doulas are risk-free, evidence-based additions to your birth team. They support both you and your loved ones, and they help out physically, emotionally, and informationally. And so if you're considering a doula, now is a good time to start looking into that and doing your research and work on interviewing so that you can find somebody and you've got time to get to know them leading up into the end of pregnancy and labor. So good luck.